Case 15 is a 45-year-old gentleman who suddenly collapsed at an exercise change room. He did not have any significant history of trauma and was found to be conscious on arrival to ED. He reported having a very severe headache, the worst headache of his life, he said. His GCS was 13 out of 15. He was mildly confused and opened his eyes only to verbal stimuli. He demonstrated neck rigidity on flexion, which worsened his headache, and the remainder of the examination and laboratory investigation were non-contributory. On selected CT images, we see that there is this hyperdensity within the basal cistern, the left sylvian fissure, and adjacent to the cerebral falx, which is the membrane that outlines the midpoint of the brain parenchyma. These findings are in keeping with subarachnoid hemorrhage. Subarachnoid hemorrhage refers to presence of blood within the subarachnoid space, which in normal cases should be surrounded by CSF. But in subarachnoid hemorrhage, instead, there is blood within these spaces. The clinical presentation include a thunderclap headache that's often associated with photophobia and meningism. The patients can often present with collapse or some loss of consciousness. And the demographics, they tend to occur in a younger population, less than 65 years old, and accounts for approximately 3% of strokes and 5% of stroke death. In terms of etiology, trauma usually requires significant trauma result in subarachnoid hemorrhage. These can include high-velocity motor vehicle accidents, for example. You can also get spontaneous subarachnoid hemorrhage. In most cases, these are due to ruptured berry or arterial aneurysms in up to 85 to 90% cases. In about 5 to 10% cases, you can get venous rupture, resulting in subarachnoid hemorrhage, and these are referred to as perimesencephalic subarachnoid hemorrhage. Any spontaneous subarachnoid hemorrhage warrants further investigation with CT angiogram performed in arterial phase to look for these berry or arterial aneurysms. In terms of risk factors for berry aneurysms, these include family history of cerebral aneurysms, hypertension, heavy alcohol use, abnormal connective tissue disease, such as polycystic kidney disease, Ehlers-Danlos syndrome, Marfan syndrome, or neurofibromatosis type 1. Female gender and African descent also represent a minor risk factor for the formation of berry aneurysm. Here are some CT anatomy of the basal cistern. You have the suprasellar cistern, which is this, that forms the Star of David shape. You have the crural cistern, which surrounds the midbrain and diverges out. And you have the ambient cistern, which surrounds the midbrain and converges in. And you have the quadrigeminal cistern, which forms this sort of W shape at the posterior aspect of the midbrain. And with subarachnoid hemorrhage, you can get hyperdense material within the basal cisterns or in the sylvian fissure. Again, spontaneous subarachnoid hemorrhage warrants further investigation with CT angiogram to look for those arterial aneurysms. So this is case number 15, a case of subarachnoid hemorrhage likely caused by berry aneurysm given the lack of traumatic history.